afternoon to all the SOCP members, our esteemed panelists, and everyone who has tuned in today. Also to our guests, we've invited the ANC and COSATU and SANCO, as Comrade Jenny had indicated. But as you all know, there's a big march tomorrow, so some of them might be very busy mobilizing for the march, although quite a lot of mobilization is already underway. And then we also have representatives from the HSRC here. So very welcome to them, and we're looking forward to your participation as well during the discussion period. For those of you who don't know me, although most do, and Comrade Jenny has already indicated, my name is Geneva Fourie, and I am a Central Committee member of the SOCP. This is the second Josie Mpama webinar, which is now a monthly SOCP activity. We have named the webinars after Comrade Josie Mpama as a tribute to her as a Black South African woman who joined the South African Communist Party, or the Communist Party of South Africa as it was then known, in the 1920s, and who was a committed organizer, mobilizer, and leader. The webinars are designed to get experts in their fields to share their knowledge on a specific topic, but also to enable the sharing of the SOCP's posture and analysis in relation to gender equality and gender transformation. The first webinar that we had, and most of you attended, was on gender-based violence. And this one will be on the gender dimensions of the COVID-19 impact. And the third one, next month, will be on childcare as an enabler of gender equality. So as you can see, all these topics are very powerful topics, very necessary topics, and we hope that you will be regular participants in all of the webinars. So allow me to take you through the program now for the next 2 hours. We will be receiving a presentation from Professor Priscilla Reddy, which will be followed by a presentation by Professor Sarah Motswetsa. Professor Reddy is the Deputy Executive Director of the Human Sciences Research Council, and she's got a good support base here today, and has an illustrious career in the fields of academia and health in South Africa and internationally. Professor Motswetsa is an Associate Professor of Sociology at Wits University and is also the Chief Executive Officer of the National Institute for the Humanities and Social Sciences. She has published several articles as well as a book. So as much as the two panelists are esteemed academics and social scientists, they are also activists. And that's why it's appropriate that they be present on this platform today to share with us their knowledge, both from a scientist perspective, but also from an activist perspective. And they will share with us information that's based on the research and the surveys that were conducted by their various institutions. After the presentations, we will receive a response from our very own intellectual and activist and revolutionary, Comrade Jenny, who is a member of the Politburo and the Central Committee, and who is also our head of secretariat. And after the 3 inputs, only after the 3 inputs, so you must please put off your, silence your audio for now, so that we can hear Professor Reddy clearly. We'll then open up for discussions from the floor, and you are free to raise your hand. You are free to make comments on the chat, all of which will be recorded. And of course, you are free to comment on Facebook. And after the discussions, we'll receive closing remarks from the panelists, and then we will conclude our session. So once again, everyone, thank you very much for tuning in, and please feel welcome and feel free to participate. Professor Reddy, I'm now handing over to you.
Thank you, Comrade Geneva. Can you all hear me?
Yes, you're very audible. So I'm going to switch off my camera so that they can be. Thank you. Please proceed.
Thank you. Thank you. First of all, I'd like to say thank you for the invitation to participate in this important webinar, seminar, and also more importantly, to participate in a seminar that's named after Comrade Josie Mpama. Her life was one of service, dedication, and the plight of workers and women. So it is indeed an honor to be talking in her name today. And I do hope myself and the HSRC does us well, comrades. I would also like to thank people at the outset, because it always gets tiresome at the end. I'd like to thank Dr. Imbarani Naidu, Ms. Ronelle Supol, and Ms. Yolandi Sheen, who are three women who worked very hard in preparing this data, because we had done several presentations to the country and to the community at large, but we'd never done a gender analysis. So Comrade Jenny got us on our train and demanded a gender analysis of the data, which is wonderful. We're so happy to share this data. So we're entitled our surveys, Understanding Gender in Relation to the COVID-19 in South Africa. Results from two surveys, the South African Lockdown Survey, which was conducted in April during Lockdown 5, and the South African Healthcare Worker Survey, which was conducted between April and May 2020. Inadvertently, the Healthcare Worker Survey with its participants became quite a female survey, and you'll see how I shared the data. So thank you for that. I'll start the formal data sharing now. By way of background, I'd just like to say something in general about pandemics, and that is whatever the pandemic might be, it always exacerbates or exaggerates inequalities and vulnerabilities. And this is specifically among girls and women, the population at large, but the people that feel it are often girls and women. We also note that women play a disproportionate role in pandemic responses, including frontline healthcare workers, social workers, caregivers at home, and as mobilizers in their communities. And that's who Josie Mpama was. Sorry, I'm just having a technical hitch. I'm trying to get to the next slide. Apologies. We really slides. Be with you. I'm just trying to get the technical thing sorted out. Sorry about this.
No problem.
So you should be able to see the first slide now, the second slide, and now I'm on the third slide. So just to remind us where we were, I was giving us a background about the population during the outbreak of this pandemic, COVID-19. So here I'm just highlighting a few important points that we should think about. I know everybody knows this, but it's often nice to reflect on these points. So let's look at the experiences, the risks, and the exposures faced by women and men. And these are often different. How? Gender differences in the labor market participation and roles and household roles lead to different levels of exposure to men and to women. Women traditionally carry the care and the labor responsibilities in the household, as we all know, which means that they are at the front line of the COVID epidemic response at home. Women's roles as caregivers, just by being a caregiver, makes them more susceptible to any type of infection from sick family members, and increased childcare demands make their work-life balance difficult. Women are 70% of the health workforce and are leading on the front lines of the COVID-19 pandemic, women constitute a much higher proportion of the care sector. And here I could not find data on South Africa itself. So we took, COVID specific data as we were looking, and you see in the European Union, which are the rich countries, 80 to 90% of the childcare workers, the teachers, personal care workers in the health services, and domestic cleaners and helpers are women. These professions are largely undervalued and underpaid historically. A high proportion of women are employed in other essential jobs that involve contact with others. For example, supermarket cashiers are often women, ticket clerks are often women, and they all face greater exposure just by where they work and stand and play. The slide looks like a complicated slide, but it's a very, very important slide, and I'll take us through it slowly. So here what we're looking at is we're looking at the COVID-19 cases by sex as of the 27th of September. And this was the most recent one we found. Now, if you look at the color, the green are female, the purple color is male, and then we have unknown. As you can see, the majority of the confirmed cases in all age groups are female. The peak cumulative case for women was between the ages of 30 and 34. If you look at that line there, it's high. But basically, it's high between 20 and 60 to 64. The difference in cases by gender may be due to more women being employed in some occupations, such as teaching and health, also attributed in part to varying testing practices by age, sex, and differing healthcare seeking behaviors. Important to understand this, and you'll see how we move through later. So also, when we look at what typically we call in health and in science case fatality rate, all it means is the number of people that die. If you look at the case fatality rate, something strange happens here, but it's checked carefully and these stats are correct. We find that 22.3% of males die and 16.8% of females die. We don't really know exactly what that's about yet. The pandemic is still a bit new. There are ideas, but I'm not, we're not sure. So if you look at the next slide, and we're looking at data by sex, 3rd of March to the 19th of September. And we look at incidence. Now, just let me explain what incidence means. It means that these are the number of new infections, new cases. And it's important to know not just what's happening over a month period, but what's new, what's happening every day, because that helps you to develop interventions and to understand how big the epidemic is or how small the epidemic is. And here we're looking at a cumulative incidence risk that consistently high among females. And look at the numbers here. We look at 61,000 cases per 100,000 people. So if you look in a room, there's 100,000 people, 1,261 new cases will be female and 947 will be male. This shows the need to understand the impact of sex and gender on the incidence, that is the new cases, as well as those people who die. And you can see it in the graph here as it goes up and up and up and up and up. Just by way of some definitions here, I mean, one can get very complex about this, but I thought that it's important to keep it simple, but at the same time to understand it. Sex refers to biological and physiological characteristics as we typically know it, male, female, and intersex persons. Gender, on the other hand, is a social and cultural construct. We're looking at norms, behaviors, attitudes, community practices that are associated specifically with being a woman or a man or a girl and a boy. Now, this is important because targeted approaches need to consider both sex and gender, so they can be, as well as measures of intersectionality, in order to develop a tailored response to the epidemic, because one size doesn't fit all. We would like to believe that, but it doesn't. The WHO called for member states to collect sex disaggregated data to understand the gendered impact of COVID-19. And South Africa did do that, as you saw from the stats I showed you. Next one, please. Now, let me talk very, very quickly. I know this is a busy slide, but it's important that you know and understand what the HSRC did. We did a whole lot of rapid surveys, and it had to be rapid because the epidemic was moving faster than we could think. So we called our lockdown survey Asikuluma, or the Street Talk survey, and it was conducted between April 8th and 23, and it was during lockdown 5, a very difficult time. Why did we do this? We wanted to understand behaviors, attitude, and knowledge of South Africans during the lockdown and the impact of the lockdown on their lives. As you know, this is a very difficult epidemic. This pandemic, we don't have a vaccine yet. We don't have many. And at the time we were doing this work, there was no steroid to treat. We had very, very few drugs. So we had to turn to the next thing, and that is human behavior and practice in terms of how we can curb this. And only this week, it just shows you how important behavior is. A certain president in a certain part of the world, male, refused to wear a mask. And we saw within a short period, over a dozen people in the upper echelons of his cabinet infected. So it just shows you don't always need drugs to protect yourself. There are simple things we can do, take responsibility and protect ourselves. And I think that is the best demonstration that President did of not observing health promotion and behavior change practices. Frontline Talk was the healthcare worker survey, which was conducted during April 11 to May 7th. And we did this in partnership with University of KwaZulu-Natal. And the aim here was to understand the response of the healthcare workers to COVID-19. This included things like their knowledge, their behavior, their training, their work experience, as well as their personal health and well-being. How are they feeling as human beings? What did we do? We did this using an online method because, you know, I'd never done an online survey like this before. I have done 30 years of research, but all the research we did was always pen and paper, pencil, using cell phones. I'd never done something online, and I was always not sure how these online things work. I was just concerned that you won't hit the right target population because only those people who have gadgets can answer the questions. But we developed another methodology to make sure that we got what people would call hard to reach people who don't have many gadgets to answer the questionnaire. And little did I know that the healthcare survey would be about working class people until the data came through and we started analyzing and we spoke with Comrade Jenny. Also, I want to point out that the data was benchmarked or weighted to the respective national distributions of South African adults. As you know, we have a certain history in this country and we have to benchmark things to make sure that it's representative and generalizable by age, sex, population group. And in this instance, we did it for province as well, because the different provinces were behaving differently in terms of the epidemic. And we wanted to make sure that they were generalizable. In other words, we could say what we're saying about everybody in that particular age group or that population group. We used gender, male and female and other, as self-reported by the participants. We found a very small sample of those who selected other. Hence, we are not able to include them in this group because they were just not big enough for comparative analysis. So everything you'll be seeing that I'm going to show you now is going to be about male and female. Right, I'm going to go straight into the data now. This is the purple and gray slide, as I call it. It's looking at the demographic profile. And this is the way South Africa is nationally because we benchmarked. So we're looking at 52.1% of that 19,000, almost 20,000 participants were female. Half the sample were female. Over 1/3 of the females said they lived in a township, followed by 30.3% who live in a suburb and 20% who came from rural localities. We tried to really get a deep understanding, even though we were doing it quantitatively in a difficult time using an online survey. I know this is busy, but it's important. So the lockdown survey, we're looking at access to water and toilets. These are the basic needs of a human being, be it male or female. What did we find here? Just remember, purple is female and the gray is male. Among the females, the majority had piped water for hand washing. However, just under 10% had to use a public tap. It was piped, but they had to use a public tap. Analysis of access to water by whether or not the main water source was shared showed that 19.3% of women versus 23.3% of men shared piped water. 5.2% of women versus 5.7% shared unpiped water. And we're giving you this data because, you know, we didn't take the liberty to make recommendations here. What we thought is it's important for us to share the data, but you are the ones that have the experience and would think about, you know, what interventions need to be put in place. Among females, 18% indicated that they had a pit latrine or a traditional pit toilet. The total of 44 women indicated that they had to go in a bush or a field. I know out of 20,000 people, that's very small. But as activists, no woman should do that. Not now, not in 2020. Among females, 21% shared their flushed toilet facilities compared to 26.3% males. And a further 6.7% shared the pit toilet latrine compared to 8% of males. Okay, here, this is an important one. It's about risk perception, meaning, do I see myself vulnerable to get this virus? Don't I see myself vulnerable? And how am I moving from place to place? I'll go quickly through these numbers, but they're important and interesting numbers, right? Overall, you see that 6.2% of South Africans left their home to collect a social grant. Now, when we did this analysis by gender, we found that females were 8.1% left home to collect the social grant. And as you can see, we've put the little numbers here on the graph, but I've summarized it in words and I'll go through them because I also think it's important. 4.3% of women did not feel confident that they could prevent themselves from contracting the virus, as opposed to 2.9% of men. 6.6% of women did not feel confident that they could prevent their families from getting the virus, compared to 4.3% of men. Nearly a quarter, 25% of women considered themselves at high risk and 29.7% at moderate risk. Among men, these numbers were lower, 24.3 and 28.7 respectively. We also found that 21%, almost 1 in 5 women, said that they had left their village, their suburb, or their township area in the previous 7 days, compared to 22.9% of men. It's more or less the same, 1 in 5. 4.2% had a household of bigger than 10, compared to men which was 4.5%, but they're very similar numbers, you know, small differences, but similar numbers. Approximately 6% said someone new had moved into their home since the lockdown had started, compared to 7% of men. Remember, we were not allowed to move, because if we moved from an unsafe bubble, we could take infection. So that was an important thing at the time. And for me, this was one of the most important parts of the presentation. I know now a lot of people are presenting economic data, but this was the first data that was presented about the lockdown on economic hardship. I know there's several surveys that are coming out, but this was the first one and the only one at the time. And we based it on 4 questions. We wanted to make it simple, related to feeling that the lockdown was making it difficult to them. 1, to earn money, to keep their job, to feed their family, and to pay their bills and debts. Perceived economic difficulty was high among women, 23.6%, and moderate for nearly half the women. So if you take the high and the moderate, you know, a large proportion of the women said, over 3/4 said that there was some degree of difficulty. And you can see it on the graphs on the other side. Among females, participants who responded to how to react to financial hardship, a quarter said that they would arrange for late payments with their creditors. Compared to males, more females said that they would arrange for late payments. Nearly 15% of the females said they would not be able to pay their bills, and just under 10% said they would skip meals. Overall, more females said that they would skip meals than males. Not surprising. Okay, this gender-based violence question is a tricky one. At first, people didn't want us to ask it because they said asking about gender-based violence is problematic, but we felt that it was important and we should ask about it. So even though only 750 participants of the almost 20,000 responded, a total of the 28% overall indicated that there was an increase in gender-based violence during the lockdown. And look at the graphs there. Among females, about 1/4 said that physical attacks had increased, while 31% said that such attacks had remained the same. Okay, and remember, some of these questions, when we called people, because not everybody had access to the online, we were actually physically telephoning people and asking them the question. So you must remember, these people are responding in their homes. You don't know who's standing next to the woman. So I was personally myself, I was just grateful that 750 participants actually responded to this. If we look overall, 6.3% said that they had to report to the police station for domestic violence. Among females, 5% said that they had to go to the police station to report domestic violence against them, compared to 3% of the males. So more males actually physically went to say that this is happening.
Earn your own money. One is what exactly? Look, you people both, when you started working, I mean, you went to pay for and you started buying your stuff. Remember? Yeah. You got money.
Can you please ask them to mute? Thank you. Okay, here we're looking at gender-based violence, and the reason we put up this slide is that you can see we're starting from pushing, shaking, throwing something at you, moving right over to stabbing you. And we specifically wanted to know these things. And you see, we moved from 2.3% right through to 0.2%. So among those females who participated or answered these questions on whether or not they experienced being physically attacked, we gave them several options. Over 2% said they were pushed, shaken, or had something thrown at them. And then you see the more nasty ones become less. Now I'm going to talk about working class women. These are the frontline healthcare workers. Okay, as you all know, the healthcare workers have been at the forefront of the epidemic and are at high risk of contracting the virus. And as we know, these numbers were big at the beginning of the epidemic. They have long working hours, psychological distress, fatigue, occupational burnout, stigma, physical and psychological violence. And I'm not saying this, I've taken this from the WHO. This is what the WHO is saying about world healthcare workers. Approximately 24,000 South African health workers were diagnosed with COVID-19 as of the 2nd of August, with 181 recorded deaths. And we got this out of the mouth of the Minister of Health from the 5th of August. And that was the exact data we had, so we're using that still. We know that our labor unions called for stringent measures to protect healthcare workers in the form of personal protective equipment, safe transport for those who make use of public transport, regular screening of the healthcare workers, and then rotation of the staff, and the provision of counseling facilities to assist with the enormous amount of mental and emotional strain, as our data will demonstrate. With a high number of COVID cases in Africa, and South African healthcare system has been under very, very severe pressure. Nurses, predominantly female, we know make up the backbone of the healthcare system. So we approached all healthcare workers, as you'll see in the data. I'm just showing this slide. I really like this slide. And this slide shows us when we did the study. You see the two blue lines there. At the time we did the study, we started on the 11th of April. we had 2,003 cases with the incidence of 69 a day. By the time we finished on the 7th of May, we had 7,800 cases with 236 daily cases. And that's what the slide is trying to remind us of when we did the study, because things have changed so much now. A total of 7,607 healthcare professionals participated in the survey. 78.2% of the sample were female. A fifth were younger than 30 years. 70% were aged 30 to 59, and 10% were older than 60 years. So you see, there's a great range of women, from very young women to women getting older and falling into the elderly range, and therefore more vulnerable, participated in the survey. And you can see the age distribution, and you can see the race distribution. Professional category, and look very quickly, the survey, and in fact, somebody asked me, did you target nurses? Why you got more nurses than other people? No, we did not target nurses specifically. We targeted all healthcare workers. And it turned out that 37% were nurses, 35% other health professionals, and medical practitioners or doctors as we know them were about 29%. Now, if you look at the breakdown by gender, this is important. Medical practitioners, 61% female. Healthcare professionals in general, 78% female. Nurses, 92% female. And the other category made up of all, from dentists, psychologists, radiographers, social services, everyone else. This survey is, this slide is about self-perceived risk by gender. Now, if you look here, we broke down this by male and female. So each one is medical practitioner, male, female, male, nurse, female, male, other, female, male. And what we see here is that women or females perceived themselves, more females perceived themselves at higher risk of contracting COVID. And importantly, risk perception was highest among nurses. Almost 3/4 of the nurses perceive themselves as being at high risk for contracting COVID. Now, as the SACP thinks through and works with other political parties, I think this is a very, very important stat as we develop our NHI, which is what the country needs, which is what's important. But if this is how our nurses, who are the backbone of the NHI, feeling, I think something needs to be done, and it needs to be done yesterday. Concerns about family members and personal health. Again, we broke this down by female, male, and the professions. I'll take you to the end. We're looking at overall female and male. You can see 71.9%, almost 72% were more worried. So what we see here was that when asked about concerns regarding their family, 70% of the females and 68% of the males reported that they were highly concerned about family members and their personal health. Nurses reported significantly higher concerns about their family and personal health. And we know qualitatively stories about how, many nurses lost family members and themselves and family members. Now, for me, this slide here is a really, really important one. What we tried to do on this online survey is to measure psychological distress. And here we did an analysis by gender and professional category. So I'm going to take us through this slowly. It's important. Here, the way we are social scientists. So what we do is we use scales, because you just can't answer this in yes, no. A scale is, like 1, 2, 3, 4, 5. You have to measure it, asking several questions and asking how strong or weak that issue is. So we measured the presence of psychological distress, just ordinary psychological distress, but it's distress. And we also measured severe psychological distress, right? And you see what we did is we have female medical practitioner, male medical practitioner, female nurse, male nurse, female other, male other, female overall, and male overall. if you look at this, female healthcare professionals consistently had higher levels of the general distress, but also of the severe distress, psychological distress, than the male counterparts. A quarter of the female nurses were severely distressed. Now, this is in keeping with the previous finding, and this is important. I know this presentation is not about mental health, but if we're not in balance or in tune with our mental health, it's very difficult to perform physically, which is what these women have to do when they're caring under difficult circumstances. Psychological distress by gender and professional category. Now, again here, there's a story for working class women. Female healthcare professionals, on the average, were 1.64 times more likely to have psychological distress than the male counterparts. And we made sure we statistically adjusted this for age and a whole lot of other things in order to make sure that this is an accurate statistic. And Renal and Imbanda worked hard at making sure that this was correct. Generally, what we see in South Africa, females have 1.2 to 1.6 times higher psychological distress than males. And you can see it very nicely shown here in blue, in a kind of, not a graph, but a diagram. So what we did here was, then we wanted to understand, okay, we're saying females, who were these females in the study? What were they? They were younger. Where did they work? In the public sector, NHI. Who were they? Nurses, working class women, backbone of the healthcare system, had high risk perceptions of contracting COVID. So they were going to work scared, worried, but still going, still holding us together. And those who reported not having workplace well-being services. So they were working in a space where, like, maybe there was no, no service that they could go to, no, I don't know, a well-being service is what we call it, a mental health service. And then we tried to compare this to other studies, and we found studies on psychological distress, and these findings are similar to work done in the HIV world. The general health and well-being. Again, here we used a scale to measure general health and well-being, and we see low well-being was more prevalent among female nurses and medical practitioners. Overall, 27% of females were classified as having low well-being compared to 16% of males. So as I said earlier, we really have to look at the story of gender in South Africa and work hard on it very quickly. So just by way of a very quick discussion, COVID-19 has had both primary, that means immediate, firsthand, and secondary effects related to sex and gender. Primary effects related to the different proportions of females and males who are infected, that is the cases, and those who die. Remember, case fatality rate. The secondary effects are differences in social and economic issues, including gender-based violence, which we measured, but we didn't measure in detail. This is a lot, but it's important to know. I'm going to go through it quickly. We looked at water access. What did the study find? We found that 10% among women said they use a public tap as the main water source in a household to wash their hands. Just over 5% shared water source. Toilet access among women, approximately 18% said that they had a pit toilet. Of these, 6.7% shared that pit toilet, and some women said that they had to go to the bush. So what's the context? The stuff in the gray is about context, right? Because I said in fact, I was just too nervous to think about recommendations talking to this audience, because I felt that you all are the more experienced people and would come up with much better recommendations than we could think up for the situation. So access to safe and portable water, adequate sanitation are important determinants of health, basic determinants of health. Unmet needs for these basic amenities pose a challenge, and challenges that comply with messaging around washing hands and hygiene to prevent disease. People wonder why we're asking about this. One of the most important things we were saying to people was wear a mask and wash your hands. So HSRC, let's find out how people are accessing water. Let's find out about their toilets. Women are predominant caregivers of children, and the elderly. Elderly are vulnerable and involved in food preparation of the household. Not having easy, accessible, clean water places them in positions of vulnerability of COVID, and then for onward transmission. Fetching water takes up time. It might be good for exercise, but it takes up time, and it's hard work. There's no data, baseline data, that we could find on hygiene practices, so we can't compare it really. It's not going down. Sorry, I'm having that same problem again. Just adjusting the slide again. Sorry about this. We're almost at the end. The issue of risk perception is very important, because if you perceive yourself as getting a particular disease, be COVID or something else, it will impact how you can function as a human being. And what we noticed, that women felt a greater vulnerability than men with regard to high risk for contracting COVID. They were not feeling confident to prevent themselves and their families from getting the virus. More women had left their area during the lockdown than men. Among females, 8.1% had to leave home to collect a grant. So here we see that a higher risk perception could again be related to those care roles that I presented earlier on, both in the home and if they go out to work. And this is called a double burden that women bear. And this is very clearly evident, particularly in our results among the nurses. The finding that high risk perception among females is consistent with risk perceptions from 10 other countries, which are listed there. And these authors indicated various explanations for why women could have, women feel this. Maybe it's their direct experience with the virus. Maybe it's how they receive the information about the virus. Maybe they got the virus themselves, and at the same time, they still go out to do things that benefit society. Health and well-being was significantly lower among female nurses. In May 2020, Stats SA reported that among women, about 46% said that they had worked in the week prior to the survey. So the week before the survey, they worked. Furthermore, just over half the women said they had a temporary absence of work, and we know during lockdown what the issues were. For men, 48.7%, this figure was 48%, and the main reason was as a result of the lockdown or general illness. Unpaid care work has been called the missing link. The gender gap analysis on the labor outcomes. Every minute a woman spends unpaid care work presents 1 minute less that she could potentially earn doing a market-related activity and hopefully gain a market-related income. And or invest in her educational skills or her vocational skills. And this corresponds with what they said to us about economic hardship. Most women said they had some, and it was either high or moderate. And coping with economic hardship included things like skipping meals and not paying bills among women. The gender-based violence, in terms of the HSRC data collection, I wouldn't say this was the best set of data, but during that time of COVID, I think it was probably the only data set where 25.6% of women said they had physical attacks had increased, while 31% said the level of these attacks stayed the same. 5% of women said that they had to go to the police station to report the violence, and 2% said that they were pushed or shaken or had something thrown at them, and another 2% said that they were slapped or had their arm twisted. Now, if we go to some general data, we see the SADHS of 2016 reported that 1 in 4, that is 25%, ever partnered women aged 18 or more experienced physical, sexual, or emotional violence committed by a partner in their time. So even though our data was small, we're seeing relationships here. Physical violence was the most common form, that is the pushing, shaking, hitting, kicking, dragging, or beating. Yeah, so that was the gender-based violence study. Thank you very much for the opportunity to present, and I hope the presentation was clear.
Thank you very much. Thank you very much, Professor Reddy. Yes, indeed, it was very clear. We appreciate your gendered perspective on pandemics and particularly COVID-19. And it was very interesting to see the different experiences in terms of risks and exposures of men and women because of our location socially and economically. I saw that there was a question by Andrea regarding possible underreporting, but we will attend to that when we get to the discussion section. For now, we will welcome the next presenter, who is Professor Moswetsa. Yes, Professor Moswetsa.
Comrade Chair, thank you so much for firstly for inviting me and also for chairing this session. A special thank you to Jenny for ensuring that I do participate and I show up. So a special thank you, Jenny. I will share the presentation, and what I normally do is just time myself for give a presentation of about 15 minutes to allow for discussion. So I'll start by doing just providing some background, and very quickly, and as I said, I don't want to be long at all. My inputs today are based on an ongoing research that we have conducted in 5 townships in South Africa, from lockdown level 5 until lockdown level 3. So. And I think to just present the whole survey won't be useful, especially in light of the topic at hand today, the impact of COVID-19. I thought before I even go into slides and explain myself, I thought I could start by making certain propositions, for a lack of a better word. First, I want to suggest that the crisis of COVID-19, and maybe just let me just try to stop my video for bandwidth purposes. The crisis of COVID-19 is indeed a crisis, and I suppose it's a crisis at many levels. But I want to suggest that it is a crisis like many other crises that we faced the world over many decades ago. But what we are looking at essentially is a crisis of capitalism and patriarchy. I think that the link between capitalism and patriarchy makes our response as nations, as the world, to COVID-19 much more complex. And while the health professionals of the world are gearing up to looking for a health solution in this instance, a vaccine, and all efforts should be done to make sure that we have this vaccine. I think we should not lose sight of the fact that there is a bigger crisis, that if we resolve ultimately the crisis of capitalism that we've all noted in many such forums, and the crisis of capitalism, that any future crisis like COVID-19 we will be able to resolve in a better way, much more efficiently. I want to suggest that with capitalism, our context of capitalism makes our response of COVID-19 much more difficult, makes the context of capitalism makes our analysis much more our analysis of COVID-19 much more complex. If you think about it, yes, in South Africa, in terms of where we are in terms of our economy or our relations to, and I know I'm in a safe space here, to our means of production. I think COVID-19 has made that difficult. But is it COVID, or is it the nature and the problems with capitalism? I want to make the argument that our relationship to the means of production makes it harder for us to even talk about, is it the impact of capitalism or is it the impact of COVID? I want to argue that it is a crisis of capitalism. Let's focus our energies on resolving the structural and the ideological problems that got us here in the first place. So think about it. We, as a country, South Africa, our location, we can't respond to the challenges of COVID-19. But if you look at other advanced, so-called advanced countries where Facebook and this platform, Zoom, are placed, they've done very well. I mean, Facebook has the owners of those means have done very well for themselves. They've increased their wealth significantly, and COVID itself, therefore, for them has not been an impact or a negative impact. But what we see the world over is that because of capitalism, the effects of, or the impact of COVID-19 has further led to global inequalities. They have further made us again ask the question, what is the role of the state? What is the role of the so-called invisible markets? And we know in this, at least in this forum, we are safe to know that our hunch is that where there's high state involvement, where we don't leave the markets, think about private medical aid, where we don't leave the markets to do as it pleases, we stand a better chance to deal with COVID today. Tomorrow it might be another crisis. The focus of today's presentation is mainly on the second, I want to call it ideology, a system, a structure called patriarchy. Again, COVID-19 was just a catalyst again to remind us that there is still this bigger problem called patriarchy, of unequal power dynamics in our society, in our households. What I'm advocating for is that as we think about COVID-19, let's think about place, context, class, gender, because all of these matter as important variables in understanding where we are. As I said, I think part of most of my presentation, I don't want to necessarily do a macro analysis of who has benefited out of COVID-19, because in itself, capitalism, we're not all going to benefit. It's only going to benefit a few. I want to focus on patriarchy. I want to suggest that with COVID-19, what we have seen is suddenly the coming together of multiple crises. The crisis of social reproduction, the crisis of subsistence production, the crisis of commodity production itself, and the crisis of representation, social representation, political representation. For this particular presentation, I want to focus on the crisis of social reproduction as the major impact of COVID exacerbated by a context of patriarchy and capitalism. Let me ask two questions, and I want to use two variables to understand this crisis of social reproduction: time and money and money use. And look at how in the households that we've looked at. Remember, with COVID, what has happened is there's been a forced retreat to a particular institution called the household. The household, as we know, and some people want to romanticize it as all resources, i.e. in this case, time and money, are shared equally. We know that it is an unequal society, and therefore those two resources, and I want to call them resources because they're important resources in a time of crisis, they're not shared equally. So with the 300 plus households that we interviewed, it was very clear that because with COVID, because with lockdown, most individuals were not able to earn a living. There was less expenditure. So there was less expenditure because there was less money. But if you look at it, women are spending more of their money taking care of the basics, taking care of the household. I want to make the argument then that the impact of COVID-19 is a burden that is not equally shared. It's a burden that is very, very, very gendered, but look at it in also in terms of where you are located the world over, in terms of how wealth in the world over is equally shared. In South Africa, you are worse off as compared to if you are in the UK, but you are also, or in the global north per se, you are also worse off if you are working class. You are also worse off if you are also of a particular gender. In this instance, in South Africa, in the five townships that we've looked at, more women are spending their money limited as is on taking care of their own buying food. Food is, as I said, there's a crisis of subsistence production, food insecurity on the rise. Time. When the world was going into lockdown, there was a part of the conversations, if you were paying attention, that said, oh, this is fantastic, it's more time with family. So, the notion of a family is going to be cemented. I think even though there has been more time, you automatically know that time has not, as a resource, has not been allocated equally amongst men and women. Are we surprised? No. This is the point about COVID-19. That what it has done is just exposing what we have always known, and therefore our complete focus in terms of analysis and mitigation strategies around COVID-19 might just be misplaced, because then we're going to have another crisis in another decade, and we're going to be asking the same questions. Who pays for the family? How do they pay for the family? And I want to make the argument that this is just what we know around patriarchy, that it is women who will shoulder most of the burden. Who takes care of the kids and the elderly? Again, it is mainly women. There is of course, this data is showing that there is some improvement when we are under lockdown, when there's an improvement when men also take on these roles. It's interesting that we are talking here working class. Think about everyone who had a job and was working from home and has a partner. Did the partner also do the more work? And it is suggested here that unpaid work has increased for women generally under lockdown with COVID-19. That's not new, and I don't want us to even suggest anything is new. Otherwise we're going to focus all our energies on COVID-19 while there are bigger structural issues we need to deal with. I want to suggest that how we use our time, or how these households have used their time and income has further exacerbated intra-household dynamics. Those power relations come up where these women are asking those difficult questions around, why are you watching more TV? And I watch less TV, and that's where those fractures almost immediately. You see why for the first time we can explain, or not even for the first time, this data is giving us information about why there's conflict in these households. It's precisely because time use is different for both men and women. I want to conclude with this slide and suggest and come back to what I was talking about when I started around issues of different crises that we experience as a result of COVID. And I want to argue it's not COVID. COVID is just a catalyst of an unequal world based on gender, and an unequal world based on distribution of wealth and resources. As someone said once, what's to be done? There are a number of initiatives, and there are a number of ways in which we could, as many formations, formations respond to this. And one of them, and I will end at this. One of them is what the Communist Party is running with. It's interesting that we are talking. It's October. I mean, the idea that the campaign that the Communist Party has been waging around the Red October campaign, that the burden is also not equally shared between the state and capital. It is interesting that the financial sector continues to do well. It is interesting that capital now wants to be on the retreat. It does not want to do what is right by society. And again, I think these are many ways in which we could, as many formations, respond to and bring capital to account and take on its own responsibilities. There are many other initiatives that we can think of that some of you have led in different spaces. The notion of food sovereignty, for example. Let me stop here. I see my timer is saying I still have 42 seconds in my 15 minutes. Let me pause here to allow for further discussion. Thank you so much.
Thank you, Professor, for that concise presentation, but yet very, very informative. It was very good to hear you locate the pandemic within the crisis of capitalism and patriarchy, and making the linkages between place, class, and gender, and particularly our relation to the means of production. I'm going to allow Comrade Jenny to input quickly, and then we will take the discussions.
Thank you, Comrade Reneva, and thank you in particular to comrades and professors Priscilla and Sarah. I think for me, the first dimension that I wanted to lift up is the importance for us as the party of this type of relationship with social scientists to be able to ensure that our approach, our policy, our strategies are deepened and informed by the scientific analysis the social scientists can bring to the fore. I'm very excited by but I'm also hoping that the rapid surveys that were done by the HSRC will be redone, because I think that as we move into COVID level 1 and then hopefully not backwards into COVID level 2, being able to reflect on how those dimensions have changed over time becomes critically important for us. So I would hope that as the South African Communist Party, we would be making better use of this kind of material. I must say, as I reflected on what was being presented, I think that there are very important strategic alignments between the information that has been given to us today and our own strategy and responses. But I do think that of gender mainstreaming in our social science work in the state and in the universities is critically important, and we do need to consistently engage with that and pose the questions that enable us to get a deeper understanding of the particular way that capitalism, patriarchy, colonialism, neocolonialism, and racism unfold in our particular society. I think the dimension of locating the COVID-19 pandemic in the context of the crisis of capitalism, with its kind of threefold or fourfold nature of the pandemic on the one hand, the social reproduction crisis on the other hand, the economic production crisis on the third hand, and the climate change crisis, for me, is a critical part of it. And I think that at some stage, the webinar should be looking at the gender dimensions to the climate change crisis. But I think that also wanted to link it to the point that Comrade Sarah was raising around the spatial dimension, and it comes up very strongly also in the HSRC figures around, for example, the sanitation access. we are faced with a historical apartheid spatial geography that has both a racial and a class dimension. So that for me remains one of the major challenges that we need through this information to be able to bring up. And I think importantly, be able to break this information down into provincial specifics and even down to district specifics. For us as the party in our Red October campaign, that dimension becomes very important. Part of what we face with bringing up the gender dimension of information is the question of whether we ask the questions in the right way. Clearly the HSRC did, but also whether the participants in any survey are going to come up with the answers. And I think there the concerns raised around the low number of people who respond on GBV is critically important. It's also important for us to recognize that in the GBV command center, which is where one would expect the highest level of reporting, it's apparently only about 6% of the calls that they receive that actually relate to GBV. So I think a challenge for us as the party, as the alliance, as social scientists, to be able to dig deeper into that is a critically important part. In both of the presentations, the responsibilities that women have in the caring role is part of what has made us particularly vulnerable to the inequality and to the impact of COVID-19. And I think for me, when one's looking even at the points that were raised around the health workers and the occupational health and safety issues, we need to be able to look at that not only in the formal economy, but in the informal economy and in the unpaid home economy. And in a sense, if we're looking at the occupational health and safety issues that come to the fore in the COVID-19, we need to be looking at them across all of those dimensions. As we go into the discussion, I would hope that we would be drawing from the presentations that have been shared with us, the analysis that has been shared with us, to be able to say, yes, COVID-19 has in a sense put a horrible floodlight on the level of inequality, and particularly the inequality around the most basic things of life. How do we ensure in our economic and our social recovery program that goes forward that we don't revert back to that, and in particular, we don't revert back to the patriarchal gender division of labor inequality? Last comment is on the importance of this information for our Red October campaign. Because if we are able to use the information that is shared with us, our understanding from this and our thinking about what is to be done from a gendered perspective, we should be able, through the Red October campaign, to ensure that the gender inequality that lies inside the inequality that has been brought to the fore by COVID-19 is part of what we ensure that we sustain, we transform rather than sustain, but that we sustain the strategies that are designed to ensure that access to water, access to hunger, food security, the design of human settlements, and the access to healthcare is all something that helps to lessen the gender inequality that is implicit in the working class and racial inequalities that we deal with. But in conclusion, very empowering discussions, presentations, and I hope that the discussion is going to enable us to deepen that. Thanks, Comrade Renee.
Thank you, Comrade Jenny, for linking the two presentations to our campaigns in the party and how the information can be utilized in a very effective way, also for highlighting particularly how the presentations speak directly to our Red October campaign. Now, there have been some comments in the chat room, and while we wait for, I'm not sure if people have raised their hands. Comrade Jenny, can you see anyone? So while we wait for people to raise their hands, maybe
there are no hands.
Yeah, so maybe Andrew can raise a question now, if she's still here with us. The question around underreporting, and then Precious has made a comment about race. So I can give the platform to the two of you. Andrea?
Sure. My question was quite simple, and it was just about the comparatively lower levels of psychological distress that the HSRC survey found among men. And I wondered if part of that reason might just be that men are less likely to admit to struggling because of narratives of masculinity. Would that be one of the possible reasons, amongst others, obviously?
Okay, thank you, Andrew. We'll get Comrade Priscilla to respond. Precious, do you want to raise your point on the platform?
Yes, Comrade Geneva, if I'm allowed.
Of course.
Thank you so much. Comrade Geneva, firstly, I would like to appreciate this very important discussion, very educating, and also to acknowledge the party leadership, CC, and also in particular our convener of the Gender Commission. I think I have seen her here. What I wanted to, as I was following attentively the presentations by the two professors, I was excited with the detail, and with the first presentation, what excited me more was its acknowledgement of intersectionality and also, gender, roles evolving, sex, and so on. I was so excited that she mentioned also intersex people and so on. But then I felt like there isn't much analysis of the location of, in fact, racism, factoring racism on how, oppression exposed itself during COVID, of how the inequalities that were there were in fact also reinforced by racism itself as it manifested during COVID-19 times. And I waited thinking the second presentation also come and touch on race. It was very strong on capitalism, but I just feel like I don't know why we don't want to also go deeper on the race, the role that race is making, and especially these times where there are many incidences of racism. The discourse on racism is back, and any kind of reflection that we make should be able to show that all these forms of oppressions and inequalities have a way of reinforcing themselves in one way or another. Thank you so much.
Thank you so much, Comrade Precious, for that very important point. We'll get both presenters to reflect on it and expand on that tiny little, the tiny oversight. Are there any more hands, any more people who wish to comment? I can compile our convener, Comrade Bulelwa. You're welcome to comment.
Thank you very much, Comrade Geneva, and thank you so much to the two the two professors. It's always good to have these scholars amongst us, because when we debate these issues and take decisions, we are taking those decisions being informed by an authentic research. So thank you so much. In fact, I wanted to add another dimension, Comrade Jenny, that we normally talk about and do nothing about, which I believe it's high time that these discussions are taken to our people, to the masses, as this leadership. I think we need to find a way of sharing the information that we get from these platforms. For instance, if you look at the role the role of these, the command centers, your gender-based violence command centers, and how those are issues debated there relate to everything that we have mentioned here. It's very critical for us not to keep that information, but ensure that that information is shared amongst our communities, especially women who are affected by this. Maybe we can also discuss a strategy that is going to ensure that we reach all these sectors, not only women, but everybody. But the reality of the matter is that those that are affected are women. If you look at the discussions around water and energy, and look at the role that we're supposed to play there, even if you are talking about road networks, there's a relationship in terms of how women feel, what how they suffer in the process of gender-based violence, and how they relate with men, especially in our communities, the poor, the marginalized communities. So I think it will be important for us to say, this is the information that we have, and how do we ensure that during the Red October campaign, tomorrow during those that will be joining the strike, how do we ensure and influence such that the workers and the working class understand the predicament that we find ourselves in? I think it will be very important for us to also look in that, especially that the challenges of social production, it is very clear that the system itself, there is no way that you can talk about the challenges that we face without talking about the economic system, which is capitalism. And thank you so much, Comrade Jenny. Comrade Reneva.
Comrade Reneva, you need to unmute.
Thank you, Comrade Convener. I saw Comrade Ntombi Zodwa's hand is up. I'll allow you to speak.
Thank you, Comrade Reneva. Good afternoon to all the comrades, more especially the CC members of our party, the gender convener, and appreciating the presentation done by the professors. I agree with Comrade Jenny when she says, for us to be able to craft any form of a program, we really needed this scientific presentation, scientific analysis of the COVID-19 to see how did it impact on the gender struggles that we are facing. For us is what needs to be done, because all what is exposed by the COVID-19 is the negative impact of capitalism on our society. Because if we want to implement our minimum program as the alliance of the NDR, we can't leave gender struggles because they are part of that, of the NDR. And we really need to focus our attention on the total implementation of the programs of the NDR, starting with economic emancipation of our people, because what we have seen during this period of the COVID-19, we saw how our people are living daily in overcrowded settlements, where it was even difficult for the larger percentage of our people to quarantine, because one household having one room is having more than 10 people living in that particular room. So the human settlement sector on its own was difficult. Whereas water which was necessary for our people to be able to prevent the spread of the COVID-19. Water was also one of the essential part for us to prevent the spread of the COVID-19. But it was difficult even in urban areas, because we know that we're having the highest percentage of our people moving to urban areas in search of greener pastures, where they are not properly catered for because of the volumes of people moving from rural areas to urban areas, making such a strain on how services are being provided by our municipalities. We find our people, most of them living under poverty. So all these are the challenges which are the evidence of the impact of the capitalism. COVID-19 exposed that the triple challenge of unemployment, poverty, and inequality is existing amongst our people. But what needs to be done? We need a strong state, but it is difficult for our own states to practice sovereignty, because they are controlled by other powers elsewhere. Because of this crisis of a capital, our states are being dominated by finance capital, making it difficult for our state to make proper planning to provide for its citizens. The finance capital wants its own needs and interest to be synonymous to the interest of our people, of it's something which cannot be done. So what needs to be done? We need to focus on our NDR, focusing in the economic content of our NDR, trying to change the economy to favor the majority of our people. Because if our people are emancipated economically, most of what we need will be provided for. But if we were still having those previously arranged economic systems, we need this structural adjustment that Professor I don't know, Professor Priscilla, or that she talked about. Because all what we see during this period of COVID-19 is just an exposure of what is existing. But what needs to be done, we need to implement that radical economic transformation that we talked about in all our conferences as the Alliance. So we need to do that, because if we do not change economic content of our living, it will be difficult for us to change many things. Because even this thing of gender-based violence is based on the frustrations that we have because of economic content of our NDR. So we need to emancipate ourselves economically so that we can change the social nature of our people, so that everything that is needed for us to live, to experience, to enjoy the freedom that we obtained in 1994. So we need to do that. And lastly, in fact, we need to take a conscious decision to deal with capitalism, because all the problems that we're experiencing are coming. Their source is because of a capitalism. If you can deal with capitalism without any fear or favor, we implement what we resolve in all our conferences so that we can fully emancipate our people. Because if we can take what Amilcar Cabral is saying, Our people, they don't care about our ideas. They want to see their own living changing, their own material conditions changing, so that they can be able to provide for their families. So if we can do that as the Alliance to change the economic conditions of people so that the people that we lead, our society that looks upon us, we change their lives, we change their material conditions, so that a person who is regarded as a mother and a father in his or her household can be able to provide for his children. Thank you so much.
Thank you very much, Ntombi Zodwa. I think your comment touches on, or it expands on the inputs by all the presenters, and also some of the matters that were raised in the chat room. What I'm going to do now is in the absence of hands, and because we are busy wrapping up, I'm going to ask all three panelists to contribute. I'll start with Comrade Priscilla, and then move on to Comrade Sarah, and then Comrade Jenny can wrap up. Yes, Comrade Jenny?
We've just had Comrade Zuliswa raising her hand, so perhaps let's take her as the last contributor.
Oh, yes. Okay, you can be the last contributor. And then if you could be a little bit concise so that we can give our panelists an opportunity to respond.
Thank you very much, Chairperson. Greetings to you and all comrades. We welcome the presentation made by our professors, which is a scientific presentation, which I think we appreciate it. Chair, will bear with me with the issue of free voice. Chair, mine is to say, maybe we as communists, we need to, because we are in alliance with ANC, which is the ruling party. I think most of the time we go to congresses and we go to conferences and we go to commissions and we raise these issues that we are still raising even today. But it's unfortunate that this becomes a theory and you find that there is no implementation. So what I would suggest is that maybe we need to make a follow-up on the implementations of the resolutions that we take in these congresses and conferences that we attend, because I'm worried that we'll keep on raising these challenges that are facing us, gender-based violence, hunger, etc., and etc. But you'll find that these things are there in the commissions that we sit in. I think, to me, the problem with us here in South Africa is the implementation of resolutions. If we can then maybe, if we can embark on doing a follow-up on the implementations. And further, Chair, I think we as the party, it is important because ours is to influence. It is important for us to be members of the African National Congress, because for now we are still in alliance. We should be members of the African National Congress so that when the African National Congress go to policy making, we are there as members of the ANC and we influence those policies towards towards the benefit of the working class. What I've noticed, Chair, in the area where I stay, is that most of the time you find that the people who attend these policy conferences, you'll just see people who enjoy moving from their places to township to where the venue is. And you'll find that the delegates to these conferences are just elected factionally, not that they see the potential of a person who is capable to speak there or to raise issues that are affecting us here on the ground. And you find that we are nowhere, because most of the time we complain that ANC doesn't want us as SACP, therefore we don't want we don't want to be there. So my chair shortly is to say we need to be members of ANC, and we need to be there to ensure that whenever to influence in the ANC, and also to go to the policy conferences so that we raise these issues, and furthermore to ensure that we do the follow-up to the implementations of the resolutions that we take in our conferences and in our congresses. I thank you, Chair.
Comrade Reneva, you are muted again. Comrade Reneva, you need to unmute.
Okay, so we thank Comrade Zodwa for making that link between theory and practice and the importance of following up. And yes, as we say, every communist, a community activist, every SSCP member and ANC member. So we appreciate that you've emphasized that. We are now going to ask Comrade Priscilla to make some responses based on the comments that were made and any additional comments that she would like to make. And then Comrade Sarah, and then we'll conclude with Comrade Jenny, who will wrap up everyone's discussions and then also concretize how, once again, how it links to the campaigns of the party. Comrade Priscilla?
Comrade Geneva, thank you very much. And thank you, comrades, for your questions and mainly statements. Andrea Teagle, I can't really respond to whether there was underreporting by the male healthcare workers. We've done our best to deal with confounding. We've benchmarked the data, and more than that, we can't say. Comrade Precious, Comrade Bulelwa, Comrade Ntombi Zodwa, and Comrade Zoliswa, I think you've all raised such critical issues, not only for this presentation and the seminar in the name of Comrade Josie, but for the nation and for the country. In terms of gender, you know, the other night, the young woman in my life helped me to watch a movie. And that movie was about Gloria Steinem and Flo Kennedy and the feminist movement. And it was a stark reminder that you cannot separate racism and feminism. You can't separate the two. How women's reproductive rights and reproductive functions are controlled perpetuates racism. So absolutely, Comrade Precious, it's there. So also, Comrade Bulelwa, you raised the issue, which Comrade Sarah did a very, very good job of framing the theory for us and bringing it all back in a language that we understand, and then demonstrating this with the study that she did. But I think, you know, I think there's a denial of how we've come from apartheid or how we haven't come from apartheid. And I think we all want to resolve things in a non-violent way. So all of you, all the comrades have constantly worked to some kind of resolution, be the resolution making or ensuring that all South Africans have water, all schools have water, there be a flush toilet for everybody. We've all worked to that. But at the same time, we still stuck on what apartheid did to us. You know, to unfold 400 years of colonialism and apartheid is not a simple job. And yes, I know there's been fraud. I know there's been corruption. I know there's been a lot of roadblocks. But having said that, it is difficult. And I think it's important for us to acknowledge that women, as women, in a system of oppression, you face this intersectionality of several types of oppression overlapping. So you have socioeconomic issues, you have the issues of race, sometimes you have the issue of being marginalized, and the whole issue of how we are arranged, you know, still according to apartheid housing, has actually made the fault lines of apartheid and our history, the racism, the sexism, it actually highlighted, it dug those trenches deeper. And this is what you're talking about. Now, what can I, as a mere researcher at an institution like the HSRC, do? I think there is things that you can empower me to do, and that is reframing the research question and demanding questions that deal with sexism, that deal with racism, that deal with the intersectionality of feminism and the overlaps of oppression and discrimination. I think you can empower me to get funds to answer these kinds of questions so that I don't have to depend on funding from donors and answer the standard questions that donors want us to answer. I don't think, you know, I'm in a position to sit here and sort of give solutions. You are the ones that are out there in the party doing the work. You are the ones that are doing the huis besoek and the house to house visiting and seeing what it is. I think we have to find a way together as researchers or social science researchers and party members and you know, comrades, to see how we can deal with this empathy gap that we have. And there's a whole lot of research on racism and the empathy gap, because unless we change that empathy gap, we're not going to move forward. And I really, really appreciate the fact that all the comrades here were so supportive of our presentations and so supportive of using data. Thank you, Comrade Reniva. Thank you, Comrade Jenny.
Thank you, Comrade Sarah. Can you give us an overview, please?
Thank you so much, Chairperson. Let me just reiterate 4 things. That sometimes we take research and theory and think that it is abstract, and it is things that, because sometimes we also use concepts that are unknown precisely because we are academics, that we think that those don't resonate with everyone. I am very pleased that everyone and as I interact with the different structures, I know that these are things that we talk about every day. We talk about them at conferences, as someone has said. Let me just raise 4 things. One is the issue around racism. I think for me, in my study, it didn't come up. I was doing research in townships, and we know that townships are of a particular race, or race analysis cease to exist. But in any case, I suppose I'm a scholar of class. I'm not a scholar of race in that instance. And while I acknowledge that race is an important variable, I don't go out in the world and doing race analysis. And I think if we want to have another seminar on race analysis and COVID, I think another scholar will be better placed. But having said that, I also want us, given that it is this platform organized by the party, I want us to recognize that racism has always been used to divide. and racism in its nature, like ethnicity, like gender, like all of those social constructs have always been used to divide. And what is as a movement we've always talked about is the issue around uniting around the notion of non-racialism. And I think every time when racism comes up, I think we always have to ask the question, who benefits at whose expense? And it is usually to divide. The second thing that I want to mention in relation to, I think it's Bulelwa who mentioned it very strongly, is the issue around we made commitments. We know that there's the NDR, and the NDR holds most of us, all of us together in the ideal society that we want. That we are faced with corruption, that we are faced with COVID-19, that we are faced with gender-based violence, does not negate the ideal society that we said we want, and that we should always aspire to get to. So I at this point in time, politically, economically, and otherwise, there's a lot of pressure, and I'm not surprised of the issues that are coming up. But fortunately, it's South Africa. There are things that we can hold on to, and I agree, Comrade Bulelwa, that the NDR is there, and maybe it's time that we go back to it and read it again, and remember. But I'm encouraged by what about what you're saying. The alliance again, and I'm not mentioning these things from my own. I'm simply echoing what was said. I've heard the party talk about a reconfigured alliance, and I'm sure Comrade Jenny is better placed to talk about how we could indeed talk about a reconfigured alliance to take us forward as South Africa. Finally, the last point is this, that the research in the townships, my research and our research in the township is telling us that COVID, yes, had a big impact economically, but it also had political and social impact. Think about it. Under lockdown, we could not have community meetings. Under lockdown, we could not have our normal NGO lives that hold us as that is that fabric that holds us together. So it seems to me that under lockdown level 1, and hopefully we won't get to another 5 and 4 and 3, that we need to rebuild our communities again. And that thing that brings all of us together in a community where you could go to a neighbor and ask for sugar and coffee. Under lockdown, we could not necessarily do that. I think there is a role that the party can play in rebuilding our communities, in saying it is okay, we've gone through a crisis, but let's rebuild from our various community initiatives. For example, gender-based violence. We have many initiatives in various communities that have assisted even our men to grapple, and someone talked about masculinity or toxic masculinity that leads to gender-based violence. Under lockdown, those community organizations ceased to exist. Right? So I think this is the time where, again, we rely heavily on certain spaces, the party in this instance, to lead in rebuilding our communities. Again, thank you so much for inviting me to share some of the findings from a bigger research. I appreciate also the challenge around let's do praxis. Let's do praxis. Thank you so much. Thanks.
It is us that are thankful and appreciative of you giving your time and your very insightful inputs. Comrade Jenny, over to you.
Thank you, Comrade Reniva, and let me echo your appreciation to our panelists, but also to our participants. There's some lively debate taking place in the chat, which we will need to pick up on. So let me start there with the issue of the relationship between race, class, and gender, which from a party perspective we see to be inseparable. The point that is made in the presentations and re-emphasized by Comrade Sarah in her summary, that apartheid geography has also given us predominantly racially defined communities is something that we need to be looking at very seriously, because when we are building a non-racial future in a country that still remains predominantly spatially racially defined, we've got enormous challenges, and I think that that's part of what we need to be able to take forward. For me, the strength that we should be lifting up in a discussion like this, where we are talking about the gender implications of social phenomena, economic phenomena, political phenomena in South Africa, is to be able to draw on Kolanta's understanding that there is a social basis to the woman question. There's a social basis to the patriarchal experience that we have. And in South Africa, that is deeply rooted in colonialism of a special type, which combines the race and class, and they are inseparable. There's an interesting point that has been picked up in the chat around whether we should be using the term our people or we should be using the word the people, and very varied interpretations of it. And I think that it's a very important element for us to be looking at. We need to ensure that we are neither talking about our people as if they are a commodified thing that we use in the purposes of executing a political struggle. The social distance between us as activists and the people who are living in our communities, the working class, predominantly Black working class in South Africa, becomes critically important. So on the one hand, we need to people as an instrument that we are using, we are mobilizing in order to achieve our particular objectives, but at the same time, we need to ensure that we address the very real social distance that has emerged between our organizations and the people of the Black working class. So I think there's a very interesting debate there, that we do need to understand that we are not distinct from the people. We are not distinct from our people. We are not distinct from the working class. We are not distinct from our working class. And we need to ensure that we address that. And I think that gets me to one of the points the point that I will conclude with, which is our responsibility in relation to mobilizing the motive forces. But I thought before I got into that part that I needed to pick up on the importance in all of the discussion around us understanding the relationship between biological concepts and social concepts. So we saw it in the discussion around the concept of sex and gender. It becomes critically important for us to be able to understand how those relate and overlay and interplay with each other, particularly because as socialists, as members of the Communist Party, we are required to be able to develop approaches in a socialist society that mean that the relationship between our biological functions as human beings, whether they are female biological functions or male biological functions, do not become sources of inequality, sources of oppression, sources of patriarchal relations. And that for me is a very important part of us being able to look at what are the biological sex dimensions of the issues that we're talking about, and what are the social constructs, and what is the future that we are taking place. There's been a very strong emphasis on the importance of policy development informed by evidence, monitored through evidence, the implementation challenges that we have as a nation, and the importance of us doing that monitoring and ensuring that we're doing that monitoring in a gender-sensitive manner. There is no point in us going and doing monitoring if we are not able to determine whether the beneficiaries, in fact, are changing the gender inequality perspectives. So one of the elements that we have identified as a party is that while government is correctly and very usefully developing a district development model that is designed precisely to find a solution to some of the implementation challenges that have been identified in government. It's important for us to be putting in place district development fora, which are broad-based, broad front, pulling together everybody in the district, both organized and unorganized, in order to be able to ensure that there is a mechanism for people-driven development, people-driven monitoring of development. And that aspect of being able to ensure that we are driving that from district level becomes critically important in terms of us being able to ensure that the district development model does not become a mechanism for one of two fights that we are waging. The one being the fight against austerity and neoliberal economic policy that simply is not going to address the needs of the working class. And on the second level, to address the corruption and the state looting that has also fundamentally undermined these towards the majority of South Africans who are predominantly Black working class, and of whom women are 52% of the population. So that then gets us to the issue of the theory and the concept and the practice, and the importance of us being able to ensure that the theoretical and conceptual and analytical work that is being done both in the science institutions of South Africa and in the party, if we do not mobilize the motive forces, the capitalist forces are well organized and well mobilized, and they will ensure that on each of the issues that we are concerned about, as we're talking about the impact of COVID-19 and its gender dimensions, that the solution that is found and the trajectory that is found is not in the interests of Black working class women. So whether you're talking about the NHI, national health insurance schemes, public-driven, all-inclusive and all-encompassing national health schemes globally have not been implemented unless the motive forces of the revolution, the working class, the masses are properly organized. And in our context, and particularly in the COVID-19, it is not only the working class, the impact of the COVID pandemic, the impact of the health burden that we have, the disease burden that we have in South Africa impacts not only on working class communities, it impacts also on the middle class communities. Even those who've got medical aids find themselves outside of that. When we're talking about food security, we will not address food security unless we organize around it, unless there's issues that we take up actively. We can organize around it in the form, as we've said in our Red October campaign around food gardens. We can take it up through issues around food prices and competition commission. We've had historically very important competition commission work being done around the price and the manipulation of price of bread in South Africa. As a Communist Party, we have a very, very strong history in organizing around food prices, and not only that, South Africa. If you go and look at the Great October Socialist Revolution, what was the trigger that set that off? Women protesting about what? The price of bread. So the food security again becomes a critical element of us being able to mobilize around. When we're talking about water, again, it's an issue of ensuring that the water policy that we have in South Africa, which is fundamentally good policy, it is based on water as a national asset, not as something that should be commodified. In practice, is it translating into that? No, it isn't. Is it being corrupted and sabotaged? What is our role to organize the motive forces around water in our communities so that we are able to get the maximum implementation of progressive water policy that we have in South Africa? So it doesn't matter what aspect of the the inequality that's been exposed by COVID-19, the organization and mobilization of the motive forces becomes a critical part of that. So then we get to the issue of the reconfigured alliance. Our approach as the Communist Party is that you cannot reconfigure sitting around a boardroom table. And it particularly relates to the issue that I've just been talking about. The transformation and change comes by organizing, by mobilizing the class and its allies to be able to take up particular demands, to make particular campaigns and win particular victories. So the question for me is, do we reconfigure the alliance by sitting around a boardroom, by drafting alliance responses to COVID-19, which we did very successfully, a very powerful document? Or do we reconfigure it by doing that and by on the ground ensuring that we are involved in campaigns? And for me, that dimension of ensuring that we are rebuilding the movement in action on the ground becomes the most important part of reconfiguring the alliance. On the importance of the point that I think is inherent in both of the presentations and all of the contributions, that our communities are ravaged. Our communities are exacerbated by COVID-19, but that situation was there prior to COVID-19. And it is critically important for us to take the responsibility as the party, but as the alliance and as a broad front of progressive organizations to ensure that we do rebuild our communities and enable us to have a recovery and development program that rebuilds a people-driven approach in which the solutions are found by the people in the community and not imposed from policy experts on a top-down basis. And I think that gets me to, in the last point, that it was very empowering to hear Comrade Prof. Sarah say that the work that she was sharing with us is part of ongoing research. It's really empowering to hear Comrade Prof. Priscilla from the HSRC saying that we should all be assisting in framing the research questions that enables the getting of funds to support that research, and avoiding a situation in which research questions are being shaped by those who have the money. And I think for me, that is a challenge that we, Nominating Commission, but the party more broadly as well, need to take up very strongly so that we are able to continuously engage with and continuously enable social science research to be done that is going to help the economic and political and social system that we're in to ensure that the NDR is achieved and that it does remain the most direct route for us to build the socialist future that we are committed to ensuring becomes a South African reality.
Comrades, we have reached the end of this very enriching session. Many thanks to Professors Reddy and Mosetsa for taking the time to share the very relevant studies with us, thereby demonstrating the importance of knowledge generation as a form of activism. As Comrade Bulelwa had said, our policies and programs need to be evidence-based, and the inputs by our two professor comrades have provided us with the necessary facts to make sound policy decisions. Thank you also, Comrade Jenny, for arranging this event, for your synthesis of the discussions, for your affirmation of our theories, and for programmizing the data that was expressed in the presentation. On behalf of the South African Communist Party, I would also like to thank everyone who attended and participated in today's seminar, our members, our alliance partners, our guests, particularly the guests from the HSRC. We thank you for joining us, and we say goodbye. We greet you and hope that you will stay well and that you will stay safe. Thank you. The meeting is concluded.